Good afternoon, everyone. Thanks for coming. To all of you, those here in the room and those watching online, I appreciate your attention, your interest, and your attendance at these availabilities. To our local media community, thank you. We have to work together to get the information out there in a timely manner. You play a big part in doing this, and you play an important part in making sure what is reported on is accurate. During this time, the public panic is real, rumors are happening, and speculation occurs. And it is imperative that we get the right information out there and that people learn to rely on trusted, credible sources about COVID-19. And these availabilities are a good start. We have the province's dedicated COVID-19 website at gov.nl.ca/COVID-19, which is updated multiple times a day on a regular basis, or the Government of Canada's website. The World Health Organization's website is also a trusted source that people can use for information. To those of you at home and tuned in, thank you. We are in this together, and only by working together can we prevent the spread of illness in our community, especially the spread of COVID-19. As of today, Tuesday, March 17th, there are 3 presumptive positive cases of COVID-19 in Newfoundland and Labrador. That is 2 more new cases since my last advisory. These 3 cases are located within Labrador-Grenfell Health Region. They're 2 women, 1 man. These new cases are contacts to the previous case and are not unexpected. In Newfoundland and Labrador, as of now, 494 people have been tested. Of those individuals who have been tested, 491 have been confirmed negative. There are 193 people in self-isolation and followed by public health. If you are feeling unwell or experiencing symptoms of COVID-19, which includes fever or cough or difficulty breathing, please call 811 to speak to a registered nurse. A registered nurse will provide you with guidance on next steps and what it is that you need to do to protect yourself and your loved ones. Another option is for people to take the online self-assessment tool to determine your risk for COVID-19. The online self-assessment tool is available on our 811 and provincial government COVID-19 websites. The websites are gov.nl.ca/COVID-19 or 811.healthline.ca. Extra resources are in place at 811 to ensure we are prepared to deal with COVID-19 and the call volume. People have been waiting for long periods of time to connect with 811. Right now, there is a 5-minute wait to get your call answered by 811, and there are 735 people waiting to hear back from an RN. However, there are 14 new RNs starting this week, so this will improve. Also, a reminder that the self-assessment tool is available online, and many questions can be addressed by visiting our website at gov.nl.ca/COVID-19. I want to let people know that if you are experiencing symptoms, you will be put in self-isolation, and a test will be arranged through public health, who will come to your home if necessary to administer the test. Please do not visit your family physician's office, and unless it is a medical emergency, please do not go to your emergency department. You should stay at home and call 811. When you are in self-isolation, such as when returning from international travel, you need to stay at home. You must avoid contact with others in your home. Stay in a separate room away from other people in your home as much as possible. Use a separate bathroom if you have one. If you are in a room with other people, keep a distance of at least 2 arms lengths. Do not share dishes, glasses, or utensils. If you experience symptoms while in self-isolation, contact 811. At this point, you will need to continue with self-isolation until public health advises otherwise. If you do not develop symptoms, you need to remain isolated for 14 days after your exposure to a case of COVID-19 or after you return from international travel. We need the 14-day isolation because this is the incubation period of the virus. Most people fall sick within 5 to 6 days after exposure, but some have become sick up until the 14th day. This is why we need that 14-day period of time. Social distancing is a term applied to certain measures that are taken by public health to stop, slow down, or contain the spread of a highly contagious virus. For example, I have asked that you to avoid crowds and maintain a 2 arms length distance from each other. Social distancing is particularly important for the vast majority of us who are well. We all need to adhere to this. It is up to us to ensure that we help the major effort required to contain this virus. I applaud the businesses, organizations, and municipalities who have been closing their doors and encouraging people to remain at home. As I referenced yesterday, these measures did make a difference in other parts of the world, like China, and we need to do our part as a province to contain the spread. Now that schools are suspended indefinitely, I ask parents not to hold play dates or sleepovers for their children. We are in a pandemic, and everyone needs to take steps to protect themselves and their loved ones. I know that this is frightening for some, while others may feel confused or anxious about what is happening. Please know that these feelings are normal. It's a normal reaction to what we are going through. You are not alone, and know that many others feel the same way. I encourage people to use mental health resources we have in our province for support and guidance. Visit bridgethegap.ca to access these services. You can also call the Provincial Warm Line or the Mental Health Crisis Line if you need to talk or if you're experiencing a crisis. Our work is ongoing and is going to continue for some time. This will not be a short-term situation. With that said, we are prepared and the system is working well and as it should under these pressures. Thank you to organizations and businesses that have already voluntarily shut down services. Our recommendation is that public spaces should be closed. This would include businesses such as gyms, fitness facilities, including yoga classes, bars, cinemas, performance spaces, and arenas. We also recommend that St. Patrick's Day celebrations for this evening be canceled. We recommend restaurants reduce capacity by 50% to allow adequate social distancing. Takeout orders, deliveries, and drive-through services can continue to operate and should be encouraged if people choose to use the restaurants. Restaurants should not be offering buffet service. People have been asking about mass gatherings, and previous guidelines have given you numbers. As things evolve, the message is that we want to keep you and your loved ones safe. My message is to avoid gatherings where you cannot keep a distance of 2 arms lengths from others. And that can be a gathering as small as 10 people. So you need to bear that in mind. To stay safe, wash your hands frequently with soap and water, or use hand sanitizer with at least 60% alcohol. Avoid touching your face. Stay at home if you are not well, and regularly clean high-touch surfaces such as doorknobs, remotes, and phones. People over 60 and those with underlying medical conditions are at increased risk for severe illness. We recommend these individuals avoid going out in public as much as possible. If you know someone who may need assistance, please reach out to help. Offer to run errands or pick up groceries. If you are an individual with higher risk and have to go out in public, please wash your hands frequently, avoid crowds, and limit time outside the home. We applaud businesses that have set up specific hours for those at high risk to visit. Remember, it is still safe to be outdoors. We encourage playing in your backyard, going for hikes, snowshoeing, but please respect the principle of social or physical distancing. The measures we have introduced over the past several days will help us flatten the curve and reduce the spread of the virus. These measures are no doubt inconvenient. We are not overreacting. We have seen how this has spread in other countries and provinces. We need to act now. We must do what we can to detect and contain this virus and to alleviate the spread within the community. I appreciate everyone's patience and cooperation during this difficult time. And while this may be disruptive to our daily lives, and for some it may be overwhelming, we must all work together to stay healthy and do what we can to manage COVID-19. Thank you.
Thank you very much, Dr. Fitzgerald. It's not much more than 2 months now since the end of the storm event in St. John's. And at that time, you saw how Newfoundlanders and Labradorians came together to help each other. We need to do that now, but we need to do that in a slightly different way, perhaps one we're not really familiar with, and that is to keep 2 arms lengths apart and to limit social interaction in that way and contact. That's an important social responsibility. It is not possible for the healthcare system to do all this by itself. We need our neighbours to acknowledge their responsibilities if they've travelled, their responsibilities if they feel sick, and simple good neighbourliness now has to involve at least 2 arms lengths. One of the challenges with the storm event as it wore on and the isolation that produced was again challenges around mental health. We saw then an uptick in demand for the warm line, for the crisis line, and these services remain available and have been reinforced. Dr. Fitzgerald mentioned bridgethegap.ca, that's 2 Ps. This is a mental health resource which we set up. It contains tools to help really with mental wellness rather than necessarily deal with mental uncertainty. We have doorways, which we have through the regional health authorities regarded now as an essential service. It is still available and there's still no appointment needed. It's a walk-in service. If I had to mention one telephone number for mental health services, I would draw people's attention to the mental health crisis line, 1-888-737-4668. Again, you are not alone. If you have someone who's feeling worried and in need of some company, there's a telephone, there's FaceTime, there's Skype, there's the things that Granny uses to keep in touch with the kids in Alberta. Those things have to become a better part of our life over the next little while. As Dr. Fitzgerald says, this is not going to be a short-term thing. We need to settle down for the long haul. I think at that point, I think it would probably be best use of everyone's time if I let questions come from the floor. So thank you for your patience.
A lot of people are wondering about your analysis. What are you looking for in terms of a sign that things are going well? And what are you looking for as sort of the next step where we may need to tighten restrictions further, make some of these voluntary measures more mandatory?
So at the moment, what we see are, with our case here in particular, we've seen household contacts that have been affected, and those are not unexpected. So if we were to start seeing cases where we were not able to trace back to either travel or a contact, that would be concerning for us, certainly. But there are other considerations that would make us determine if we needed to use mandatory measures if we felt that people weren't complying, for example, with recommendations, then we may have to consider that.
There has been some discussion around testing, and other jurisdictions have said, for example, for every person that we're seeing positive, we believe that there are several other people who may have it and either have mild or no symptoms at all. Are we doing enough testing? Should we be testing more people in order to ensure that we're catching any of the cases that we have in this province right now?
So right now, what we know is the biggest risk is travel. And we are asking people who are coming home now to isolate themselves for the incubation period after they get back into the country. So at the moment, we are still testing symptomatic people who have had that exposure history, whether it be travel or exposure to a known case. So that's where we're leaving it at this point, because we want to make sure we're getting the most bang for our buck, I guess, with regard to the testing.
The woman who first tested presumptive positive from Labrador-Grenfell region, is that now a confirmed, or is that still presumptive?
We're still at presumptive at this point, yes. We're just waiting for the test to come back.
As far as contact tracing has gone with this woman, have we seen that to now its full extent, or are we still expecting more positive cases from her travel?
So contact tracing has started in that case, and it is still ongoing as we speak, obviously. And now we have 2 new cases, so contact tracing has to happen for both of those cases as well. So this contact tracing is ongoing. There have been other people tested in relation to this case, so we may see more positive cases.
Dr. Heggie, I've heard from people in community health that nurses didn't have any test kits to go out to patients' houses yesterday and do these tests, and that they were also concerned because there were no masks. Can you speak to any of that? Have you heard these concerns?
They haven't been brought to the department. We have a provincial emergency operations centre as well as the health ones. The health authorities have arrangements whereby if one area is short of particular supplies, there is an ability to move those from areas where there's a relative surfeit. We have a bulk order in through our national purchasing arrangement as well as through our own provincial system, and we've also arranged with the federal government to access our emergency stockpile. As far as the test kits are concerned, Health Canada has actually gone through a rapid approval process, and we now have 2 different test kits which have been validated, so those are available now. So if there was a transient lack in one area, then that should be filled. I haven't been made aware of a shortage or issues in a systemic way.
I think you spoke to this yesterday, but can you speak to how many ventilators we do have here in the province?
Certainly. Across the province, the grand total is currently 156. We have capacity, we feel, given we've got flu season. The issue of the severity of COVID is really key in terms of the demand that might be placed on those services. We have 3 cases. Currently, each of them are manageable at home. And as Dr. Fitzgerald said yesterday, a significant proportion of people with this illness, it's a self-limiting condition that can be managed in the community and doesn't actually require hospitalization. The percentage of people who might need ventilation is actually single digits, maybe of the order of 2%.
I'm not sure if this was answered earlier yesterday, but I'm curious how many test kits are in the province right now, and are we expecting any to be ordered in or brought in from vets?
We have an order in for more,
Will it
both
happen in numbers?
provincially and nationally and through NS. In terms of the numbers that are in the province at present, I don't have that number. I can find it for you.
Okay, perfect.
I'm wondering if maybe Dr. Fitzgerald or Dr. Hagee, if you could explain the process of contact tracing. How does that work? What is the process there?
So when we have a case, a public health nurse or a communicable disease control nurse will go in and speak to the patient. They will find out every person that person may have been in contact with, every close contact that person may have had over the period that they were infectious. And so they will get a list of names, and then they will go on to contact those people to determine if they have symptoms, first of all, and if they do, they'll be immediately self-isolated, and testing will be arranged. And if those people don't have symptoms, they will be asked to stay at home on quarantine, essentially, because they're well. They'll be asked to stay at home or stay in a place where they can be away from other people and to monitor themselves for 14 days. If they don't get symptoms, that's great. And if they do, then they'll arrange for them to be tested.
And based on the contact tracing that I guess has happened so far, is there any evidence of community spread within this province right now?
None at this time.
Dr. Fitzgerald, you've talked about the need for privacy for these patients, and that's why you're not releasing further information. There is genuine fear and sometimes even panic within the Labrador area right now, because people are saying, I don't know if it's my community where these people are. How do I know if I'm at risk? I'm now assuming that it's my area, and why not provide some more specific information about what area it's in order to alleviate those concerns from lots of other people who don't know whether or not it's in their community right now?
I think at the moment, what we need to assume with COVID-19 is that you need to be aware anywhere. So it's almost like what we call universal precautions in what we practice in hospitals. So we just assume that there is an infectious disease out there that you don't want to catch, and you take the precautions to make sure that you don't. So if people stay home, if people wash their hands carefully, if they practice good hand hygiene, not touching their face, social distancing measures, then they will reduce their risk of contracting the COVID-19 virus.
You talked a lot about businesses that are, I guess, customer-facing, and some of those that shut down. What about other corporations who, it may be call centers or insurance or other, where what are you recommending businesses do there in terms of trying to make sure that people limit their exposure and reduce their risk?
We would recommend that as much as possible that businesses try to arrange for employees to work from home, to think about who's essential to their operations, and to reduce the contact between employees in the workplace as much as possible. And obviously, if you have to have employees come in, then to make sure you're providing good hand sanitizers and keeping your office clean.
The 2 new presumptive positive cases, are their symptoms mild? How long have they been developing?
So, they both have mild symptoms, and they're both at home.
Was theirs through contact, or were they also involved with travel?
No, theirs were through contact.
Schools are going to be busy places over the next 2 days as students come in to try and get supplies. Doesn't it seem a bit counterproductive to have these students all gathering one place over these next 2 days in light of what we've said about trying to have limiting the large gatherings and contact that people may have?
So I believe the schools have put measures in place to reduce the number of students who will be in the school at one time. They've certainly restricted anyone who's traveled or who's been in contact with a case from going into the school, and they have sort of have staggered times for the students going in.
I think,
my understanding.
Yes, no, that's right. I've seen that with some of the schools on the West Coast. I think one of the key things here for certain students, particularly with public exams or who might graduate this year, it's important that they have access to homework packages or their books or their teaching materials or whatever the school district and the teachers advise that will enable them to help complete their year and satisfy their graduation requirements.
Got a question about things like registered massage therapists or hairdressers or any of those sorts of professions that rely on personal contact. You obviously can't do someone's hair if you're 2 meters away. What's your recommendation about businesses like that?
So at the moment, our biggest worry is about mass gatherings. We are recommending social distancing. Obviously, anyone who has traveled or who may be at risk with exposure should not be attending any of these types of appointments. But these people will have to, these businesses will have to use their best judgment and determine what at this time is best for them.
You mentioned things like restaurants, to reduce to a 50% capacity there. Is there a particular moment when, when restaurants and some of the businesses, would be asked to close down? Is there a certain moment where that option will become?
That may happen, absolutely. If we start to see spread within the community, we would certainly want to reduce any risk that people could have of any kind of gathering. So those will be things we would have to consider as time goes on.
And I know that Ontario, of course, declared a state of emergency on this front. I don't want to get too far ahead of things, but is that something that is within the realm of discussion at this point?
So we have really good new strong public health legislation that allows us to think about a public health emergency, so that we wouldn't have to necessarily call a full state of emergency. And certainly those are discussions that we're having and we're looking at. We're not doing that right now because people have been compliant and businesses have been following recommendations, and we really very much appreciate that. But if that's something we need to consider in the future, we will.
I think from the view, from I understand it, of Ontario's action is under their regulations and legislation, it allows money to flow more freely into certain areas that wouldn't otherwise have access to that. We have not, through our whole of government approach, become aware of any bottlenecks in terms of resources that we can't meet or get round with our current setup. So we haven't gone down that road because I think there's a difference between how we would operate now with our new Public Health and Health Promotion Act in this situation versus the more traditional states of emergency. But anything's possible in the next little while.
Homelessness advocates are asking if there's going to be any public hand washing stations or more emergency shelters put in place.
Emergency shelters fall under Newfoundland and Labrador Housing and CSSD. I have reached out to Minister Dempster to make her aware of communications that I've received, for example, from the Gathering Place. We actually have a specific vulnerable persons group set up as part of our emergency structure to look at issues like that, because the homelessness piece is one area. Food insecurity with food banks, for example, has become an issue today. So we're looking at ways to do that in a way that respects the principles Dr. Fitzgerald and her public health team are suggesting, and we'll be working on that over the next little while.
And when we're looking at social distancing, we know a big mode of transportation here is ferries. We're still having a lot of people asking if we're going to change legislation or any regulations to allow people to remain in their cars. I know that's with Transport Canada. You'd mentioned this before. I just don't know if we've made any changes in that approach.
Certainly you've seen the change with BC Ferries, and I believe Lithuania, somebody drew to my attention this morning, has made alterations to their ferry requirements. I've been in contact with the Minister of Transportation and Works, and my understanding is they may have some announcement to make around ferries in the not too distant future.
Some students have raised concerns at Memorial University about having to attend classes until tomorrow evening. With the announcement yesterday and the closure of all schools across the province and CNA and the daycares, do you think it was appropriate for MUN to also continue to stay open until tomorrow evening?
They've actually changed it just as we walked in here. Their classes closed tonight at 5 o'clock. So, things change very quickly in the world today. So I can answer that question very easily.
Perfect, thank you.
Hearing some concern from pregnant women. They haven't heard any advice. What is their risk level from coronavirus, and is there anything in particular they should be doing in order to protect themselves?
So From what we know right now, it does not appear that pregnant women are affected more severely. However, as with any respiratory virus in pregnancy, that's always a concern. So we would recommend that pregnant women follow the same rules. Stay at home if you can, social distancing, wash your hands carefully, avoid touching your face, all of those same types of things.
This regards yesterday's announcement with daycares and day homes. I'm not sure if either of you can answer it. Many people having questions around if they're going to be paid and how that's going to work for daycare workers.
One of the things we've reached out to the federal government about is there's 10 billion, 11 billion in total on the table for economic stimulus and help. My understanding is that the federal government are making announcements, possibly while we're actually doing this media availability, around those kind of issues. But certainly we're conscious of the need to look at the EI accessibility in terms of how we advocate to our federal colleagues about changing that if need be, and we're certainly a bit conscious through AESL of potential gaps that may appear between income support and EI. So those are works in progress, and as I say, my understanding is that the federal government are making some announcements, further announcements about that over the course of today. I haven't seen those obviously, but watch this space. I suspect again by 5 o'clock this could be different again.
Keeping in mind that we do know the Prime Minister is making an announcement as we speak, Ontario going into a state of emergency, knowing that we potentially, at some point, not saying this is happening today or tomorrow, could go into a public health state of emergency. Have we spoken with finance as to how people are going to be able to cope through this? We already know we had a 2-week break during Snowmageddon. Many people are already struggling to pay mortgages and loans and car loans. What's being done there?
I know that across relevant government departments, the mortgage issue has been looked at. I know that everyone is very conscious of the fact that with people employment being vulnerable in terms of layoffs, particularly with hospitality industry, this is top of mind for a couple of departments in government. I don't have an answer at the moment. We're looking at it. We have limited fiscal capacity to do much more than we've thought of already. We're kind of waiting to see what the feds are going to come out with, and we've certainly begun discussions about the 10 billion that they talked about with the economic stimulus. We've been told about a down payment from the $1 billion in healthcare money. So, again, this is an evolving situation, and if you look back 48 hours or 72 hours compared with where we are, you could see the trajectory in another 72 hours could be different again.
2 questions. One about malls. They continue to be open. What's your recommendation in terms of, because that is generally a place where you see a lot of people specifically gathering. What's your recommendation there?
So, we have to be careful because certain essential services need to stay open, so drugstores and grocery stores and that sort of thing. So we would recommend that employers certainly try to keep their high-touch surfaces as clean as possible, frequently clean those, have employees protected with proper hand washing and hand sanitizers being available, and for people to avoid going out unless it's absolutely necessary, and reduce reduce their risk of exposure.
Peter, sorry, one of the paradoxes is if you look at what happened during the storm event where shops were open for limited periods, you saw the lineups outside those places. Our problem now is trying to prevent people clumping together. And paradoxically, the evidence would suggest that you're probably far better having shops and malls open way longer. My recollection when Walmart was open at 4 o'clock in the morning before Christmas is it was a really good time to go shopping.
The other question is about testing centers. We've seen other provinces establish these as a way. Now that we're seeing higher numbers of testing, are there any plans to establish similar centers here?
So those discussions have been ongoing. At the moment, our public health staff have been able to do the testing that needs to be done. So we've been able to keep people in their homes to get tested, which is the ideal situation. And if that changes, obviously, we will have to reconsider.
Yeah.
With Metrobus, is Metrobus still currently operating as normal?
My understanding is they haven't changed. That's as of walking in here. So I don't really know what their plans are. That's a city jurisdiction. But again, there's certain infrastructure that's kind of critical. You know, if you need to get to a drugstore or you need to get to the mall to get groceries or whatever, you have to have a means of doing it. And Metrobus, we saw in the storm event, played a pivotal role in enabling that. So I think, you know, whether and how much that's regarded as an essential service is a discussion between government, not health, but government in general, and the City of St. John's. And those discussions would lie in other departments.
Well, Dr. Fitzgerald, do you think places like crowding in like a bus is, you know, maybe something that needs to be limited in some capacity?
Well, I think certainly it would have to be looked at, and obviously there would have to be some discussions around how we would exactly be able to do that. Hopefully, with people staying at home and not going out unless they absolutely have to, that we would see less traffic on the bus.
We have goods being imported from out of province, out of country. What screening measures are being put in place for these coming in and for those transporting it into the province?
My understanding is the federal government have issued some specific guidelines to truck drivers crossing the border, to airline crews and cabin crews, and those kind of things. So I think that is being examined. It's being transborder is a federal jurisdiction. And again, I suspect that those things are under review by the federal government on a frequent basis, just as the kind of things under provincial jurisdiction, you've seen how they've evolved in the last 36 hours.
This is a stressful and can be a very scary time for a lot of people. Schools now closing. How should parents inform their children on these events that are going on?
That's very interesting. In actual fact, I think CBC this morning carried an item as I was driving into work, 7:15 or something, about a sports coach, how to entertain your kids. It will be challenging, quite frankly, as any parent will know. I think you need to speak to children in a way that they appreciate, appropriate for their age. As Dr. Fitzgerald said, and as we've talked about, there is an element of fear and there is an element of panic. And I think it's helpful to insulate them to some of that, but explain to them the necessity of, you know, not hugging granny quite as often as you used to, because we know there is a risk in terms of transmission. And that's going to be hard. It's certainly going to be a challenge. And there is no easy answer for that.
You mentioned public health emergency earlier. How would a public health emergency be different or distinct from a state of emergency?
So a public health emergency is declared in the event of a public health threat. So, for example, the coronavirus at this point, or COVID-19, is certainly a public health threat. And it would have to be called in the event that special measures would need to be taken in order for us to be able to control that event. And so there are, it's variable as the events can be variable, and we would have to look at several different things, for example, community spread or compliance with recommendations and those sorts of things before we could make those decisions to call it a public health emergency. Sorry,
I just have a quick question here. Somebody asking that in regards to testing, any discussion on a second local lab to do presumptive testing? I'm imagining we're going to start to see quite a few coming in there. Obviously, I know it still has to go to the national lab, but in terms of presumptive testing for here.
So all of our microbiology testing is done at our public health and microbiology lab in the province. It is the referral center for the province. So everything that will be done will be sent here. And if we need to improve resources at that lab, then that's what will happen.
Okay, thank you very much.
Thank you.